modern dentistry has a remarkable solution for lost teeth, one that doesn't just replace the visible crown, but the root itself. This is the dental implant, a precision-engineered titanium anchor designed to fuse with your body and restore full function. When a tooth is lost, it leaves behind more than just a gap. Below the gum line, the jawbone no longer receives the stimulation it needs. Over time, this empty space can lead to bone loss, but the remaining healthy bone provides the foundation we need for reconstruction. If we look beneath the surface, we see the anatomy clearly. The outer layer of cortical bone is dense and strong, protecting the softer, sponge-like bone inside. This structure is ideal for supporting an implant provided there is enough height to stay safely above the nerves running deep in the jaw. Before surgery begins, a digital plan is created. Using a 3D CBCT scan, the surgeon maps the jaw in high definition. A virtual implant is placed into the digital model, allowing the team to measure the exact depth and angle needed to avoid vital nerves and ensure a perfect fit. The procedure starts with preparing the site. A precise incision is made along the top of the gum ridge. The tissue is gently peeled back to reveal the living bone underneath, creating a clean, sterile window for the implant placement. The drilling sequence begins with a pilot drill. Spinning at a controlled speed and cooled by sterile water, it creates the initial guide hole. This first step is critical, as it establishes the precise angle and depth for the entire surgery. To ensure accuracy, an alignment pin is inserted into this pilot hole. This allows the surgeon to verify that the path is perfectly parallel to the adjacent teeth roots, ensuring the final tooth will be straight and properly aligned. With the angle confirmed, the site is gradually widened. A series of drills, each slightly larger than the last, expand the socket. The irrigation system constantly washes away bone dust and keeps the tissue cool to prevent any heat damage. Before the implant is placed, the bone may be tapped. A specialized thread forming drill cuts spiral grooves into the hard outer bone walls. This prepares the socket to accept the implant screw without using excessive force. Now, the titanium implant is inserted. Using a torque wrench, it is slowly screwed into the prepared bed. The threads bite firmly into the bone, providing primary stability. The immediate mechanical lock that holds the implant tight. The fixture is driven down until the collar sits perfectly flush with the crest of the bone. The internal chamber of the implant is visible, ready to receive the final tooth. But first, the healing process must begin. To protect the internal mechanics, a small cover screw is placed on top. It seals the hollow chamber, preventing bone or gum tissue from growing inside during the recovery phase. The surgical site is then closed. The gum flaps are folded back over the implant and stitched securely with sutures. The implant is now completely buried, safe beneath the surface, where the magic of biology takes over. Over the next few months, a process called osseointegration occurs. Microscopic bone cells migrate onto the rough titanium surface, depositing new calcium matrix. The bone literally fuses to the metal, turning the implant into a permanent part of your body. Once healed, the implant is uncovered. A healing abutment is attached, which shapes the gum tissue as it matures. This creates a natural-looking cuff around the metal, ensuring the final tooth will emerge from the gum just like a real one. Finally, the custom-made ceramic crown is placed. It is lowered onto the abutment and secured with a tiny internal screw. The color and shape are matched perfectly to the surrounding teeth, making it indistinguishable from nature. The result is a fully restored bite. The upper and lower teeth meet perfectly, allowing for normal chewing and speaking forces to be transmitted through the implant, keeping the jawbone healthy. From a missing gap to a confident smile, the dental implant provides a long-term solution that feels and functions just like natural teeth. Thank you for watching this visualization of dental implant surgery. For more insights into modern medical procedures, subscribe to Surgery Visualized.